Pose with the fans. Pose with the pose with the pose with the fans. Pose with the pose with the pose with the fans. Fans. Pose with the fans.
Hi Felicia.
Hi.
What are you doing?
Oh, I'm reading the newspaper about the delirium.
Oh, what is Delirium?
You really want to know? Okay, so delirium is...
Hello everyone! Today we will be sharing about delirium. Delirium is a type of acute encephalopathy, commonly known as brain failure, acute brain dysfunction, or altered mental status. It also emerges over a short period and fluctuates during the day. Besides, a person experiencing this may have decline in attention and cognitive function that may lead to severe neuropsychiatric syndrome. Now we will move on towards the etiology of delirium. So delirium is divided into the categories which are predisposing and precipitating factors. Example of predisposing factors are older age people, dementia, mild cognitive impairment, poor vision and hearing, etc. Next, for precipitating factors, the examples are psychoactive medications, infections, anesthesia, hypoxia, surgery, etc. Let's look at the types of delirium. So delirium is divided into three types, which are hyperactive, hypoactive, and mixed. For hyperactive, a person will increase in agitation and sympathetic activity. Besides, hallucinations, delusions, etc. could also be presented. For hypoactive, a person will increase in drowsiness and reduced arousal. And lastly, for mixed, it involves fluctuations between hyperactive and hypoactive delirium. You must wonder, what is the pathophysiology, right? So the pathophysiology of delirium is increase in age, which will reduce his body's ability to handle physical stress and illness. Neuroinflammation, which occurs at the blood-brain barrier, which will damages the connections between cells. Reactive oxygen species, which can cause cellular damage, especially in the brain. Next is circadian rhythm disruption that will affect sleep pattern and melatonin production. Neurotransmitter imbalance, which will lead to confusion and delirium. And lastly, neuroendocrine changes that occurs when stress increase glucocorticoid hormone level. Now, we are going to talk about the signs and symptoms, diagnosis, treatment and management, and also the prognosis. Firstly, signs and symptoms of delirium. To diagnose delirium, we look for a sudden drop in awareness and attention. This change happens over hours or days and often goes up and down during the day. There's usually also another symptom, like confusion, memory problems, or trouble speaking. It's not caused by a coma or other brain conditions. Doctors confirm it by checking the person's medical history, physical condition, and lab results to find the cause. To diagnose delirium, we look for a sudden drop in awareness and attention. This change happens over hours or days and often goes up and down during the day. There's usually also another symptom, like confusion, memory problems, or trouble speaking. It's not caused by a coma or other brain conditions. Doctors confirm it by checking the person's medical history, physical condition, and lab results to find the cause. The first step in treatment is to fix what's causing the delirium, like an infection or bad reaction to a drug. Some medicines like benzodiazepines can make things worse unless it's for withdrawal. Non-drug methods are the best. Keep the person active, help them sleep well, give enough fluids and food, and use clocks or calendars to help them stay oriented. We also reduce noise, adjust lighting, and involve family. Medication is only used if the person is really agitated or unsafe, and even then, in small amounts. How delirium develops depends on health and environment. People who are weak, inactive, or have memory issues are more at risk. Older adults are especially vulnerable because of aging and other illnesses. But kids can get delirium too, like when they have a fever or take certain medications. So delirium can happen at any age, but can vary depending on the person.
Oh, now I know what Delirium is.
What else was stated in the news? In the news, it also stated about the controversial issue regarding the identity with delirium.
Wow, can you share about it too?
Sure, let's see it together.
The contemporary issue first, we will see in post-pandemic. In post-pandemic, there are issue, impacts, and social theories. But first, let's see the issue. One of the major post-pandemic issue was enforcement of lockdowns, especially visitor restrictions in nursing home. Social distancing, though a major strategy to fight COVID-19, it also. Major cause of loneliness. It also well known that this is a serious public health concern among older adults. When many elderly were cut off from their usual social support networks, this could impact into the lack of stimulation and emotional support, where it can increase the risk of cognitive decline and delirium. Prolonged isolation also contribute to higher rates of depression among elderly. Elderly with cognitive impairment may have difficulties in comprehend information related to COVID-19. Furthermore, this not only contributes to onset of delirium, but also complicates recovery, as emotional distress and anxiety can exacerbate disorientation and confusion. This issue can be examined through the several social theories of aging. In disengagement theory, social withdrawal is viewed as a natural and adaptive process of aging. But in this case, the disengagement elderly experienced was not voluntary, but imposed by environmental factors. This involuntary disengagement could lead to increased emotional distress, cognitive impairment, and subsequently contribute to the emergence of delirium in elderly. And in the perspective activity theory, social isolation could result in fewer opportunities for elderly to engage in meaningful social or cognitive activities, which are essential for maintaining mental well-being. Meanwhile, through continuity theory, the disruption of daily routines and social roles interfered with the continuity of their lifestyle, leading to psychological distress and confusion. Economic impact of delirium. Direct medical costs. Delirium causes longer hospital stays due to ICU use, added medications, and extra diagnostic tests. After discharge, many patients suffer from complications, like memory loss and reduced function, leading to more hospital visits. In Malaysia, just one extra hospital day costs Rm 400 to 1,200 Malaysian ringgits. Each case of delirium may cost thousands of ringgit. Long-term and indirect costs. Delirium increases the need for long-term care. Patients often need rehab, like physio or occupational therapy, and may rely on family or paid caregivers. Other hidden costs include transport, time off work, and home modifications. Next is estimated national impact. If 20% of hospitalized elderly patients develop delirium, Malaysia could face tens of thousands of cases annually, with each case costing around 5,000 Malaysian ringgits to Rm 10,000. The total cost could reach Rm 20 to 400 million Malaysian ringgits every year. As Malaysia's population ages, this number is expected to grow. Lastly, the implications. Delirium places a heavy burden on our healthcare system, families, and institutions. This highlights the urgent need for better hospital protocols, staff training, and stronger geriatric care. Theoretical perspectives on the impact of delirium in elderly. Disengagement theory explains that older adults slowly withdraw from social roles. Delirium speeds this up by affecting memory and body functions. High care costs also make it harder for them to stay socially connected. Activity theory says aging is healthier when seniors stay active and involved, but delirium causes fatigue, health issues, and financial stress, which limit their participation and lower life satisfaction. According to continuity theory, seniors prefer to maintain familiar routines. Delirium disrupts their daily life and adds unexpected medical costs, reducing independence and stability. Next is socio-emotional selectivity theory. This theory says elderly people value deep emotional relationships, but after effective delirium are confusion and financial strain. Due to that, it can lead to isolation and a loss of meaningful social bonds. Lastly, biological theory of aging. Biological theories highlight how aging bodies become more fragile. Delirium worsens this decline, requiring longer hospital care and expensive treatment, adding stress to families and the healthcare system.
Wow, delirium is so exciting. This is something new for me.
Yes, this is also a new thing for me. I learned a lot.
You guys learn something?
Okay, that's all from us. Thank you.